Namaste. I welcome every one of you on this first episode of Mental Health Talk Show Inside Out, where we'll have conversations with mental health professionals. I am very happy to welcome Ms. Tejaswini Bhave on this show by Anhad and Punekar News. First of all, I would like to ask Tejaswini a little brief introduction about herself.
Hello, everyone. Wonderful to be on this platform. I am Tejaswini. I'm a clinical psychologist and have been practicing counseling since last 12 years. I am a co-founder and chief clinical psychologist with Anhad. I've worked with extensive population ranging from children to older adults, and I cater to various mental health needs of these populations. That's about it.
And I'm very happy to say that she has received a gold medalist for her MPhil program by the hands of Prime Minister Shri Narendra Modi. So congratulations for that, Tejaswini.
Thank you,
And we are
Kamlesh.
glad to have us on our show.
Yeah.
I know that while doing this introduction for this mental health talk show, the start was like, if are you feeling stressed, anxious, or are you under peer pressure?
Hmm.
This has been common notions, common questions recently asked by in different setups, let it be education, workplace, or your personal and professional life. So today we are going to have a interaction where we'll understand the nitty-gritty about mental health and overall well-being. So let's move to our first question, Tejaswini. Uh, so what does it
Okay.
mean to have a good mental health? We would like to know.
I'm glad this question has came up because so much is being said about taking care of your mental health, seeking help whenever it comes to you. Just talk to people whenever you have depression. Just get out of your house, go with friends. But nobody really talks about what it means to be really mentally healthy. So I think that's a very valid question, and let's really ponder over it a little bit. I think having good mental health, let's categorize it in three different aspects. So first one is a very balanced and a healthy sense of self. What we call is a healthy self-esteem. So something that does not go up to the level of being a narcissist, too much in your own love, or also being so inferior and having such a lower self-esteem that you fail at everything that you do. So first of all, you liking yourself, you really being okay with yourself, you liking your own company. I think that is one very important aspect of having good mental health, because this acceptance, this okayness with being who you are, is a foundation of your entire mental health structure. So let's talk a little bit about that. You liking your own company, and needing you not needing having somebody else all the time with you to feel complete. So we always see these codependent relationships where people always have to have that one person who will validate, who will approve of everything that you do. And that really puts you in a very needy kind of a cycle, and you cannot get ahead without somebody else approving you. So if you don't need that, if you are completely okay being on your own, good to go. Next part is you accept yourself with all your flaws, with all your strengths. You know who you are. The know yourself, the question know yourself, you know the answer to that, at least not probably to the spiritual aspects of it, but you know who you are, what you want in your life, and what you are doing right now. So that's another thing. Second is having trusting yourself that I am competent enough to deal with the daily stressors of life. Every challenge, every adversity, every compromising situation that life throws at you, you feel that okay, fine, I will struggle little bit maybe, but I can get over. I can get over all these problems and move ahead. So that feeling of self reliance is very helpful also. Then your emotions, your emotions are an integral part of your sense of expression, the way you move around others, the way you move in the world. So some people are really overwhelmed when they have difficult emotions like sadness, anger, grief, or getting criticized by others, jealousy. So whenever you have these emotions, a lot many people feel very, very overwhelmed. They feel as if this should not be happening, this is not me. They don't identify with those emotions, and then they have a lot of trouble getting over that negative emotion. So being okay with negative emotions too, because they are very important part, because then you feel challenged, and then you grow, and then you get out of that situation. So not being overwhelmed by your own emotions, that is another wonderful part. Second one, we talked about negative emotions. Let's also talk about seeking out positive emotions. So, when you have this very deeply satisfying sense of self, you seek out meaningful experiences in your life. You're not bothered by the ups and downs that life throws at you. Okay, you try to find happiness in little things. You smell the flowers, you will take a hot bath and you will feel really nice. You'll go on solo travels, or you'll spend a nice date with your partner. So these little things, these actually big things and little things like reading, having a cozy corner for yourself for meditation, these tiny things also keep adding to the meaningfulness of life, to the happiness of life. Next one, we can move ahead and see that not being completely okay in the comfort zone that you've built around you. So you need to come out of that safety zone. You need to challenge yourself and really be okay with that, because no matter whether we choose or not, you have to get out of that comfort zone, either by choice or by somebody else pushing you to do that, or a situation pushing you to do that. And I think ultimately, the very important aspect, the theme that we are working with, our Indian wisdom, our Indian tradition, that keeps telling you that go beyond just that sense of me. So always striving towards being better and better every day, trying to maximize and actualize the true and full potential of who you are. I think that is the highest level that you can reach when it comes to self development. So a good mental health, the first aspect we spoke about was sense of self, a good self esteem, a healthy appreciation of your own self. Second, social, because we are social animals, we live in society, we uh, evolutionarily also we have been a social animal. We have stayed in huge groups. As agriculture and industrial revolution happened, we have probably moved to tinier groups, but still we cannot live without people around us. So having good social adjustment and understanding your responsibility towards the society, I think that forms another aspect of good mental health. So, what comes under all these criteria? One is you're really okay interacting with people. You like spending time with people. If you're an introvert, maybe not for a long time, but still, if you are in a situation where you are asked to interact well with people, I think you should be okay, if not completely. Uncomfortable. Second is you are okay with diverse social situations. So maybe a party or a meeting, or maybe a social gathering, or going to somebody's wedding or funerals. You are able to adjust according to what that situation requires out of you. You are able to tone down your emotions. You are able to say what you are expected to say. So adjusting according to what the situation asks for, that is another healthy part of social adjustment. Next is you are okay with people, generally okay with people. You are able to trust them. You are able to give some work to them, because I know some people, some bosses especially, who try to micromanage everything. Okay, so you need to be okay, trust people, trust their talents, that they will do well. If they do well, you also have to appreciate that they have done something well. So that is another point. Then is communication. You are a good communicator. You can communicate appreciation generously, say that okay, this was something that was really good. Also criticize very constructively without pulling down the other person's morale. Giving them a very constructive feedback is another important aspect whenever you are supposed to be in a group or maybe at a power position, at an authority position. That is extremely important. Next comes to important interpersonal relationships. So people who are socially well adjusted, they always have long, deep, meaningful, and happiness giving relationships and friendships. And these uh, create a very huge safety net for the individual whenever uh, he is forced to be alone, or whenever there are trying times. I think this safety net of these beautiful relationships is what catches that person, lifts them up whenever is needed. So boosting that confidence, that happens from these groups that we have around us. Are you trying to say something, Kamlesh?
No, no, no. Yeah, please
Okay,
continue.
okay, we are good to go, right? Yeah. Next is being a good team player. So whenever I think we go to work, or even as one unit in a family, you are supposed to be a good team player. Either you are supposed to play a role of a leader or of a follower, or just a team player getting along with the group. So you always have to understand what the group is going towards, what are the common goals that we are trying to achieve. Support others as well as take help from others whenever it needs. So this taking help aspect also is important, because if you are not able to ask for help, that means you are feeling inferior in asking for help, and many a
Okay,
times you end
okay.
up being lonely. The last part of this aspect would be you understand your responsibility towards the entire society at large. You understand what role even as an individual you play. So there are various social causes that need attending to. So right from being a volunteer at nearby shelter homes, or old age homes, or being environment friendly. So there are various aspects where you can contribute towards the society, and
Okay.
you understand that how in a uh, large scheme of things you play beautiful and very important role. Because बूंद से ही तो सागर बनती है, तो बहुत सारे बूंदे अगर ये करना चाहे, कर सके, तो बहुत बड़ा काम हो सकता है.
That's
So I
really
think
great.
that's about it.
Yeah, yeah. I
Lastly,
think that's, yeah,
yeah,
yeah. Please tell.
yeah. Lastly, about the qualities that a person who has good mental health. Last one, and very important one, when it comes to defining mental ill health, it is very important. What does it mean to have good mental health when there are trying times? So all the issues that I just spoke about, it's very easy for somebody who has good upbringing, who has good environment, good parental support, good spouse, good work support. They are privileged enough to be in a hierarchy where they're not challenged for daily the strides of daily living. But when there are stressors present and still you manage to have good mental health, then all the details that I'm about to discuss right now play a huge role. So being resilient, bouncing back from that adversity, bouncing back from those stressors, that quality is something that keeps you apart from the general population. And I think these individuals comprise of merely 15% of the entire population. Let's talk about what qualities they have. So, one is they are able to balance various aspects of your life. So, that might be interpersonal, social, work related, financial, spiritual, everything. These beautiful uh, spheres of your life where you are asked to be present, contribute. If you are able to balance that very well, your mental health will flourish a lot. Second is you trusting that you can cope well with your daily stresses, be it traffic jams, be it your boss shouting at you, be your spouse complaining that, oh, you don't pay attention to me, or your children asking for more toys, or anything else that can come to your mind. That coping mechanisms present, the healthy ones, that is another huge quality that you can have. Then is really being keen about what is happening around you, and really understanding and pointing what is going wrong, understanding that some adversity, some issue has come. Many a times people are lagging behind, they are late in understanding what is going wrong. but being very perceptive about these issues can help you act really quickly and get over the issue quickly, right? So once you see the adversity, then you can understand, what do I have to do, what are the next steps that I can take, whether I change myself or I change the situation around me, and then the solution automatically comes. Your
Okay.
favorite go to term, learn, unlearn and relearn. If you can do that, I think that's a helpful quality to be more resilient. Next is having good foresight. So you know and you can anticipate what are the future needs, and then you plan ahead. And I think whenever the future looks too bleak or too challenging, you can be I think quite comfortable when the actual challenge comes, if you've with good foresight you've envisaged what might happen. Next is once again I will stress on this point, asking for help. I am feeling down and I need help. Actually saying these words takes a lot of bravery, because not all of us can do that. So that's another important quality and resilient person has. uh, Realistically understanding your favorite, again, SWOT analysis, my strengths and my weaknesses, and what I can do based on that. So many people have these huge dreams, but they really overestimate their own capabilities. So I think having a good balance between these also can help. Next is you can take your own decisions, you can be independent, and that independence or that freedom does not make you little, does not make you feel small, that does not make you feel inferior. In fact, it makes you feel empowered, that I can do this, I can make this decision, and while I take this decision, while I make this choice, I am ready to take on the consequences also that will be thrown in my way. And lastly,
Okay.
taking in stride whatever curveballs life throws at you with a lot of grace, forgiving yourself, learning from past mistakes, and not being just a doll in the hands of destiny. I think that is one quality that you would agree all beautiful leaders across the world have. They have carved their own path. They have created their own existence, their own name. So that's another quality. So
That's yeah.
effectively, together these three things: a good self-esteem, good social adjustment, and having an ability to bounce back from stressors, together create a wonderful scene for good mental health. Yeah, that's my answer
Okay.
here for
That's.
the question.
I think you have already envisaged the complete mental health scenario
Hmm.
across the
Hmm.
globe,
Hmm. Hmm.
and
Hmm.
I'm very happy you mentioned
Yeah.
self-esteem.
Yeah. Yeah.
Looking at Indian, our theme for this mental health awareness program is
Hmm. Hmm.
integrating Indian wisdom and knowledge
True. Yeah.
with Western approaches,
Hmm. Hmm.
evidence-based approaches. So, you find any literature, ancient literature, recent literature in India, you will find
Hmm.
this self, the
Hmm.
knowledge of the self. Swachi
Hmm.
oळख ज्याला आपण म्हणतो.
Yeah. Yeah. Yeah.
Yes. So I'm very thankful to you that you have actually taken up this point.
Hmm. Hmm.
I remember
Thank you so much. Yeah.
during our school days and college days,
Hmm. Hmm.
self-esteem, self-confidence, these words would be coming around, and
Yeah.
we would be,
Yeah.
our teacher would be saying, Are, just, increase your confidence, raise your
It's not that
self-confidence.
easy. Yeah.
Yeah. So, how you will answer to this such questions, or we have students. आज के ऑडियंस में कुछ पेरेंट्स भी हैं,
Hmm.
टीचर्स भी हैं,
Right.
तो एक एजुकेशनल सेटअप में क्या मेंटल हेल्थ चैलेंजेस रहते हैं अभी के इसमें, और आपके कुछ एग्जांपल्स हो सकते हैं जिसमें आपने डील किया होगा स्टूडेंट्स के लाइफ में, क्या आप उस पर थोड़ा बोल सकते हो?
Okay. Yeah. One of the challenges that I see is one ladder towards that individual growth, and it is a very important milestone. So school plays important role in shaping not just your self esteem, but also how you interact with others too. It's not just school, but children spend most of their daytime inside the school. So teachers these days are largely unaware about mental health issues. So टीचर्स से अगर आप बात करोगे तो they don't want answers to how do I teach maths effectively, how do I teach grammar effectively. No, they will ask questions about behavioral issues. The child is disruptive in class, they have the potential but they won't work towards it. So I think uh, really orienting teachers towards gauging these problems and equipping them with basic coping skills, basic counseling skills with which they can help their students, because not every time a counselor can swoop in the class and take out that student away, work with the student. No, because we are scarce, there are very scarce resources for us. uh, let's accept the fact that not many schools have a school counselor aboard. So it's the teachers mainly. So first of all, preventing teachers from burning out and then giving them these tools. I think Anhad and Punekar News, in this program, they have these various orientations and workshops lined up where teachers would be helped in having those skills. So parents and teachers need to seek help of a professional when it comes. Uh, Maybe they need to read up about a lot of parenting issues, and parents and teachers should stop playing this blame game कि teachers की responsibility है, parents की responsibility है, लेकिन बीच में बच्चा फंसे जा रहा है. So if they really own up to what they are responsible for, uh, and really look at the larger picture and
Okay.
give the child's mental health a priority, these problems will be less. Also, you spoke about this development and self esteem. I think self esteem के लिए कोई magic wand हमारे पास नहीं है, because a lot of work has to be done by the child himself, by the parents also. So what we can do is provide them that environment where that self would be flourishing and not caged. So if our schools and if our parents are graceful enough to provide that kind of environment, kaliyan zarur khilegi.
Definitely.
Yeah.
Uh, I have information that you're a Harry Potter fan
Yes, I
and you
do.
have Harry Potter's wand with you,
Yes,
right?
yes, yes.
So, movies like Harry Potter, and
Hmm.
recently we have seen there are research papers. Movies and media have a deep impact on
True.
kids' mind, children, students, even adults.
Yeah. Hmm.
So, how to be like, there's a parental control in mobile, remote control, TV.
Yeah. Yeah. Yeah.
So, how to utilize this parental control in maintaining this mental health scenario?
Hmm. Hmm. I think what you're referring to is probably extreme screen time that these kids are having these
Yes,
days. Yeah,
yes,
extreme exposure to violent games and video games, especially,
yeah, yeah.
and stuff. Even uh, I mean, porn sites also open up just like that if you're
Yeah.
online, okay, and that's very
Hmm.
scary for parents also. So not just having parental control, because when you're trying to exert control over something, that means you don't trust the child. So if a parent has a very trustworthy relationship from the beginning, these problems could be prevented at large scale. But
Hmm.
let's face it, kids are not um they're not very shy, or they're extremely smart these days, right? So they would go around those parental control mechanisms and they will find ways to access what they want to access. But if you have deep meaningful discussions that how these things are harmful for you, why I am saying no, and not giving screen time as a reward at the first place. So क्या होता है कि हाँ तुम खाना खत्म करो, मैं तुम्हें फोन दूंगी. हाँ तुम इतना होमवर्क खत्म कर लो, फिर you can have half an hour of your favorite serial. No, these are creating absolutely nightmarishly difficult associations, and which is very very difficult to break once that has set in. So
Okay.
prevention is, I think, best method here rather than cure. For cure, you will definitely have to meet a professional, follow certain steps that they will ask you, and change as a family. Because if your child sees you in the phone at a dining table, you are not at any moral place to scold your child ki phone mat dekho bacche. No, that's not that. So the family needs to change.
Yes, yes, absolutely.
Yeah.
Family system, talking about family system, still in India. a family system fortunately strong enough
Yeah.
compared
Yeah.
to different parts of the world.
Hmm. Hmm.
Women, especially, form a very important and critical role in the family,
True.
and especially in India, we are talking. There has been many issues related to women, around women, we can say related to mental health. So, can you put some light on that?
Hmm. I think your question is quite general. I mean, it's not very
Yes.
specific because women go through various kinds of mental health challenges across the lifespan. What I think is one point where women need most help with is women being trusted with responsibility and not looked down upon as a lesser gender,
Mm-hmm.
because this happens very unconsciously because of all the patriarchal systems that we are following. But still, I mean, your question, like I said, it's very general and the scope of its answers is quite
Yeah.
huge. So let's
Yeah.
limit it to something that I recently experienced is
Definitely.
postpartum
Mm-hmm.
depression.
Mm-hmm.
Okay, because whenever you give birth, you are at your worst physically and emotionally also, because your hormones are playing havoc in your body, and then you are made to feel like nobody, because everybody is looking at the child and not really at you. And then postpartum depression does not subside in the first what 40 days. It can go up to 2 years of life, because taking care of a child is a huge responsibility. It's not just taking care of the child, household responsibilities. uh, Unfortunately, our maternal leave scenario is not very uh, welcoming. Yeah,
Mm-hmm.
across certain organizations they are taking help, they are changing rules, they are allowing moms to come at work whenever they want, or work from home, or whatever suits them. But I think that has to be a policy change, a systemic change. uh,
Mm-hmm.
and women tend to be fortunately gossipers, so they try to find help with
Yeah. Yeah.
other peers. And I think that's
Mm-hmm.
one very beautiful resource that they have at their disposal, is by at least expressing what they are going through, just that venting out, there will be a slight comfort for them, not complete respite from the issue, but maybe it helps. But women do need to take that decision, uh, go out and seek for help that they need. And I think as mental health professionals, we need to create those spaces where money is not an issue, because
Okay.
women don't have
Mm-hmm.
that much freedom and that much monetary resources to pay us. So I think we coming forward, or the government coming
Mm-hmm.
forward and creating
Mm-hmm.
such spaces where they can freely access mental health
Mm-hmm.
services would be a huge
Mm-hmm.
step ahead.
Okay, okay.
Yeah.
Just a fun part of this, I would like to
Yeah.
share. I had been to a hospital recently, a heart
Hmm.
special hospital, for some of study. There I saw, like, out of 10, there used to be only one woman as a patient in heart care. Is there any relation, like being
uh,
gossipers, is it helping them?
okay, so this has to be a very non-research based,
Yeah,
non-evidence
yeah,
based
absolutely.
comment, of course, in a fun way. But yeah,
Yes.
uh, they they're less reported. I think they're less
Mm,
reported. That's one issue. And then second, yeah,
okay.
research based data also suggests that it's men who suffer more cardiovascular
Yeah.
diseases.
Mm, mm,
Women generally tend to be more active throughout the day. They won't
yes.
have a very sedentary lifestyle, they
Mm,
won't go to smoking and alcohol dependence as easily as men. I
mm,
mean,
mhm.
these days that trend is very upsetting, that even women are doing all of this, but lot many men than women do that. Okay, so they are at high risk of having cardiovascular diseases.
Mhm.
So that's answered.
Okay, okay, okay.
But yeah,
For
venting
the,
out
yeah,
helps a lot. Yeah.
definitely, definitely.
And
For
therapy.
the viewers, you can put your comments, you can ask your
Hmm.
questions, and we are very happy to answer in a very possible way. Okay.
Yeah.
Tejaswini, coming to the last segment of the show, we have talked about bad mental health, good mental health,
Yeah. Yeah.
what are the challenges, but then the major thing comes to seeking help.
Yeah, yeah.
So when should I seek a professional help?
Hmm. So when you think that your old coping mechanisms are no longer working, even if
Mm-hmm.
you try hard, it's not helpful to you. Your
Mm-hmm.
old ways of dealing with issues is stale, and I need newer
Mm-hmm.
perspectives. So
Yeah.
I am talking about an individual who doesn't have a diagnosable mental health condition, but just wants
Mm-hmm.
to get away with the daily stressors of life. When it comes to
Mm-hmm.
having a full blown disorder, a mental disorder, a
Mm-hmm.
diagnosis is something that can give a lot of cues as to the next treatment. So if you
Mm-hmm.
don't seek a professional help at the right
Mm-hmm.
time, your mental health is
Mm-hmm.
going to go down even further,
Okay.
more and more, and that's very harmful. So I think as humans, we also need to take responsibility and understand that who needs help. So most of the
Mm-hmm.
times the clients don't understand on their own that I need help. It's the
Mm-hmm.
close family members, spouses, friends who are something
Mm-hmm.
who can really not push but very gently suggest that is it okay if you want, if you feel all right, can we go and take a help of a psychiatrist or a counselor
Mm-hmm.
or a psychologist?
Mm-hmm.
What are your
Mm-hmm.
views on that? So not push
Mm-hmm.
this choice on them, but maybe
Definitely.
open the door a little bit so that they can peek out and make their own decision. Also,
Okay.
the intensity, duration, and frequency of these stressful episodes, if it is increasing day by day, uh, you should visit a professional as soon as possible.
Yes, yes. Thank you so much. So, amongst the mental health professionals, we have psychologists, we have
Yeah,
psychiatrists,
yeah.
we have therapists. So, in brief, can you just explain the difference between and
Hmm.
this how we can why we should
Okay.
go to a personal specific?
Okay, okay. So unfortunately, in India, a counselor or a psychiatrist are still looked down upon as a paglon ka doctor. Hmm?
Unfortunately,
Not
yes.
not necessarily so, and not a laughing matter at all, uh, because having that label pagal will
Mm,
really hamper a lot of rehabilitation process the person, the patient will go through. Hmm? So that
mm,
stigma needs to be eradicated as soon as possible, and I think all of us are trying a lot for that.
yeah,
uh,
yeah.
okay, so a psychiatrist is somebody who has done an mbbs and then specialized in psychiatry with a dnb or an md, and they can practice medicine along with psychotherapy. That person is a
Mm-hmm.
psychiatrist. They can
Okay.
prescribe medication. A clinical
Mm-hmm.
psychologist is somebody who has done their masters, MA
Mm-hmm.
or MPhil in clinical
Mm-hmm.
psychology, or MSc in clinical psychology. They are called
Okay.
clinical psychologists. Then
Mm-hmm.
they are able to give psychotherapy, but they cannot prescribe medications. They can diagnose, they can do assessment, but they cannot prescribe medication for you. Then
Medication.
comes counselor. Counselor is somebody who has a very basic kind of training in psychotherapy. They are able to give therapy, but probably they are not the best people to diagnose a mental health condition, do proper assessment, or suggest
Mm-hmm.
that they need a referral towards a
Mm-hmm.
psychiatrist. Hmm? A
Okay.
counselor would be helpful for self growth related issues or
Mm-hmm.
daily struggles that one can go through.
Mm-hmm.
And then there are
Mm-hmm.
various specialities: industrial
Yeah,
organizational
yeah, yeah.
psychologists, there are
Mm-hmm.
school psychologists, there are
Mm-hmm.
sports psychologists. So
Mm-hmm.
uh, various things are coming up,
Yeah.
and specializations are
Mm-hmm.
also coming up.
Okay, okay.
Yeah.
Thank you so much. The last question would be how this mental health awareness program would be useful for our
Hmm.
participants and how we
Okay.
can make it more useful, more impactful.
Right, right. Okay. So this campaign looks at mental health as not just a solitary or individual player. We are looking at mental health from a very wholesome kind of perspective, and that's how it should be looked upon. So we are trying to include every aspect of society. So that is
Mm-hmm.
teachers, that is students, that is individuals, that is workers, that is corporate workers, various. Social organizations. I think political leaders also would be interested in joining these campaigns so that some
Absolutely.
systemic change
Mm-hmm.
would be incorporated. So I think the most important factor that we are aiming at is eradication of the stigma around mental health
Yes.
issues. If we are
Mm-hmm.
more aware, if we are able to acknowledge that I need help, I have difficult emotions, I cannot work on my own, I cannot deal with this on my own, and if it's easy for you to go on Google and as you search nearest gynecologist or nearest physician or nearest cardiologist, I think it should be as easy for everyone to search nearest psychologist, nearest psychiatrist for me. uh, that is, I think, our highest aim. And then
Yeah.
partaking in this responsibility of creating a social change, because
Mm-hmm.
imagine what Anhad says is, the moment you feel heard, you start healing. So the
Yeah.
moment you think that you are appreciated, you are acknowledged and accepted for the way you are by somebody, and that mental health professional really looks up to you, sees the potential in you and helps you
Mm-hmm.
reach that,
Mm-hmm.
just imagine what kind of a beautiful society with these beautiful individuals will we have.
Yeah.
I think that's our larger aim. Yeah. We have a
Absolutely.
question,
Absolutely.
I think.
Yes, we have a question.
Okay.
Uh, the first question is, shall I read?
Yeah, yeah, I think I have read. Uh,
Yeah. Okay.
क्या सिनेमा मेंटल हेल्थ का बहुत निगेटिव साइड दिखाने की कोशिश कर रहा है? Yes, definitely, definitely, because unfortunately directors, actors don't take a lot of effort in understanding the nuances and nitty-gritties about what mental health is. तो कोई मूवी आई थी शायद कंगना रनौत की, जिसमें कुछ बहुत ही
Yes.
ऑब्जेक्शनेबल वर्ड यूज किया था, and then
Mm-hmm.
mental health professionals ran a campaign to change that title.
Yeah. Mm.
कितना इजीली दिखा देते हैं कि अच्छा कोई मेंटल हॉस्पिटल में भर्ती कर दिया है और फिर उनको शॉक लगा दिया गया है, एंड देन सारे बाल ऊपर उठ जाते हैं एंड पर्सन को, नो नो, दैट इज so disgraceful, that is so bad in taste, that you really don't understand the troubles people are really going through.
Mm-hmm.
What I was referring to is called electroconvulsive therapy, ECT, and ECT has been extremely helpful with conditions like schizophrenia, major depression, or bipolar disorders, where just traditional medicines has not been helpful at all, but ECT has been. So ECT लेने से आप कोई अलग इंसान नहीं बन जाते, आपके बाल खड़े नहीं रहते. It is done under anesthesia, it is done with most precaution, and I think the doctors are being so gentle with these patients and being portrayed like that in cinema, where
Yeah.
people really
Mm.
look up to, where these actors play a role of a role model, and if that
Mm-hmm.
is being depicted like that, I think that's really worse. Fortunately, we are having movies like Dear Zindagi, or we are having some scenes where people seek therapy and the therapist is an understanding, gentle, unconditional person helping the person really. I think these small changes would go a long way.
Yeah. Yeah. We have
Yeah.
second question as well.
Okay. Okay.
Mental means pagal in our
Hmm.
regional
Hmm.
languages.
Hmm.
So why people like you not using mind health word or mental health word? They,
Okay, I really did not understand the question,
yeah. Yeah.
but I think
Yeah.
what you are trying to say is कि कोई अच्छा word क्यों नहीं use करते? So
Mm-hmm.
something would be not of sound mind, maybe, and that only and only applies to certain mental health conditions like schizophrenia, where
Mm-hmm.
reality testing, where the person loses
Mm-hmm.
touch with reality because the
Mm-hmm.
perception is so hampered, they cannot distinguish between what is real and what is unreal, what is caused by the brain's uh, the brain's issues. Okay, only and only at that condition will we use this word of not of sound mind, या फिर पागल बोलने से मैं बोलूंगी कि डिस्टर्ब, मेंटली डिस्टर्ब बोलेंगे थोड़ा सा वो फिर भी ग्रेसफुल है,
Yes.
क्योंकि या फिर जस्ट अनहेल्दी बोलेंगे. Mentally
Mm-hmm.
mental ill health is a term that we usually use to refer to this population.
Okay. Okay.
Yeah.
Okay. Thank you. Tejaswini, thank you so much
Yeah.
for enlightening us with such a beautiful uh, understanding about mental health, explaining us this jargons into very simple words.
Yeah.
Just before finishing this talk show,
Yeah.
I would like to once again make a statement regarding our free mental health workshops
Hmm.
for schools and corporates. So
Yeah.
I urge everyone to be part of this initiative, take
Yeah,
benefit of
please
this
join these
initiative.
workshops, get your
Yeah,
skills upgraded, because I think, as they are generally called, they are not soft skills. They are very
yeah.
hard skills, in fact, which will go such a long way in
Yes,
helping you.
yes,
So I think
yes.
we should change that
Mhm.
term also. They're not just
Yeah,
soft skills, they're extremely important tools to help yourself.
absolutely. So
Yeah.
we are ending this today's episode with a thank note. Thank you so much, Tejaswini. And
Thank you,
next
everyone. Yeah.
Saturday, we'll meet with one of the best professional and try to understand his or her perspective about mental health. Yeah.
Sure. Looking forward to it. Thank you so
Yes.
much. Good day to
Thank
all of
you.
you.
Thank you.